great question, because on the one hand, so I work in really a tertiary service, but we do some engagement with people working in secondary care, so people working in memory clinics, and that's both in assessment, but increasingly in supporting people who have dementia-related visual loss, whether that's at the earliest stage of the disease course, such as posterior cortical atrophy. But there's some studies going back since the 90s that would suggest at least 30 to 40% of people with Alzheimer's disease, who again appear normal on ophthalmological examination, experience so-called higher order problems of perceiving what or where things are. So this isn't something which is completely restricted to people with PCA. Over the disease course and consistent with the vulnerability of areas towards the back of the brain being affected by Alzheimer's disease pathology, you can have people who develop visuospatial problems in particular as kind of secondary features accompanying their initial memory complaints. So in secondary care, the professionals we work with will be psychologists, occupational therapists. We put out training for the Royal College of Occupational Therapists, for example, on better understanding and managing dementia-related visual loss. In primary care, I think in one sense, we can think of still the optometrists themselves as playing a key role in primary care where people can refer directly. And again, we put out training with the College of Optometrists for their membership. That's a professional body of optometrists in the United Kingdom. In terms of general practitioners, while it's a group that we have intended to approach in the past, having spoken to a senior GP, their suggestion was, because they're bombarded with all sorts of different information about all sorts of different conditions, you want to be more targeted. And so the eye health professional route is probably the ideal approach.